Hi, Julie. This is Wendy Nixon. I read your post about technology and mental health, our topic for this discussion board. And thank you. You had some important points that I wanted to respond to. So I know you mentioned the price point of the counseling platforms as being a barrier or prohibitive for low income or even middle income countries, people that need mental health services that have no access to professionals. So I agree. I looked up. I wondered what a low-income country, what qualified a country as a low-income country. So I looked up the World Bank agency, I guess, defines that. And according to the World Bank, low-income country has a, let me see, it's a annual per capita gross national income of $1,035 or less. So that I had to read that a couple times because that's annually per year. So that was a little shocking to me. Obviously, our standard of poverty in this country is higher than that. But I agree that the platforms. I reviewed the platforms, and even the least expensive ones were about $35 to $40 per week, which would be affordable probably to us in this country, but definitely not affordable in low or probably even middle income countries. So that is an issue. And the Naslin article, though I was surprised, talked about how even text messaging, supportive phone calls, and online self-help programs, how even something as simple as that can improve the quality, any kind of treatment, I guess, helps show improvement. Research shows that people are improved in their mental health status with even simple interventions like that, which is encouraging. However, the quality, I wonder about the quality of that. I would say that I would think it would be better for local people to provide those services, so you have, maybe some clearer accountability, being supervised by local agencies. I know that I did consider the volunteer quality or aspect of the 7 Cups of Tea, the agency that you talked about. So I wondered about the quality of the volunteers, training, and what that's like, supervision. However, then it occurred to me in thinking about the Naslund article, if they're saying that even text messaging, supportive phone calls, and online programs can help improve mental health for individuals, do I need to really question about the supervision? Maybe that doesn't matter if, maybe sounds like mental health can be improved just by people knowing that there is help, or that there are people to provide support, even if the quality is not at a licensed professional level. So that's something to think about. Also, the other point that you make about the privacy, I think that is very important. I would think in, small towns, villages, that there could be a real stigma, as you mentioned, to seeking mental health services. One of the things I was concerned about, though, I ended up, would donate to the Faithful Counseling platform as a Christian agency, but I noticed that they offer that clients can remain anonymous So that made me feel a little uneasy. Who are we really treating? I suppose they could just give a pseudonym and still present real issues, but does this lead to fabrication? Are people attention seeking? Are these people real? I don't know. It just, puts a question in my mind about that. So, anyway, not sure what to think about that, but I might feel a little uncomfortable treating somebody in that situation. So, okay, well, thank you so much for your post, Julie, and very thought provoking. Take care. Bye bye.